A beautiful arm has always exuded a sense of fitness. If you have excess loose hanging skin in your arms or you're bothered by the bulkiness of your arms, then continue watching this video as I'm going to talk about how arm lift procedure can help you get the better contours of your arms. Hi everyone, I am Dr. Anshu Mishra. I am a cosmetic and plastic surgeon, and today I will explain you what is an arm lift procedure. So arm lift procedure, which is medically known as brachioplasty, is a procedure in which the loose hanging skin which is dropping down from your arms is excised. Along with that, the excess fat deposits in your arms are removed to give the better tone and better shape to your arms. Let me first talk about what can cause your arm to sag. If there is a significant weight fluctuation which can happen after bariatric surgery, or you've lost a lot of weight after diet and exercise, that can lead to the loose hanging skin in your arms. And in extreme cases, sometimes the deformity is such that it looks like the bat wings. It can also happen due to the normal process of aging, wherein there is loosening of the elastin and the collagen fibers. Therefore, the support of the skin is gone and it hangs down. So who are the good candidates for arm lift procedure? Those who have loose hanging skin in the arms with the fat deposits, are able to maintain a stable weight for a considerable period of time, and are not significantly overweight, are the good candidates for this procedure. They should also be healthy with no comorbid conditions that can impact the healing process. So it is not necessary that to get a toned appearance of your arm, you would always need an incision. Your plastic surgeon would assess the degree of the laxity of the skin, the quality and the tone of the skin, and the bulkiness or the fat deposits in your arms. If you have the fat deposit with very minimal skin laxity, then liposuction alone can help you. So liposuction is done under general anesthesia, and a very small incision is given just above the elbow. The tumescent infiltration is given, followed by suctioning of the fat using special instruments called cannulas. After liposuction, you have to wear pressure garment for a minimum of 4 to 6 weeks so that the skin can contour to a better shape. Now, in those candidates in which the laxity is slightly more and it cannot be improved with liposuction alone, needs to go for an excisional procedure. So for arm lift, there are basically 3 procedures. The first one is the mini arm lift. It is good for those who have the fat deposits but a very minimal skin laxity which cannot be improved by liposuction. So in this procedure, the incision, a transverse incision is given in the underarm areas. What it does is that it pushes the lax skin towards the chest wall, thereby reducing the sagginess. The second is a standard brachioplasty or an arm lift procedure in which the incision runs along the inner side of the arm, starting from the elbow up to the underarm area. So it is good for those who have moderate to severe skin laxity and cannot be treated by liposuction alone. The scars are generally designed in the inner side of the arm so that they are not visible from the front as well as from the back when you are placing your arms against the chest wall. The third approach is an extended arm lift procedure in which the incision is just like a standard arm lift procedure, but it extends along the lateral chest wall to deal with the excess skin in the lateral chest wall, which can be seen in candidates who have lost a lot of weight, that is in post-bariatric patients. So I would like to emphasize that yes, after an arm lift procedure, there will be a scar, but there are techniques to make that scar less noticeable by putting the silicone gel sheets, by massage, and by wearing pressure garment and CO2 fractional laser. Well, I'm not getting into the details of the scar management in this video, but definitely the scars, they improve and they become less noticeable with time as the healing progresses. So the next question is, when can I see the results and what is the post-op recovery like? So depending upon whether you've just underwent liposuction or an excisional procedure, the healing would happen accordingly. So after the procedure, there will be swelling, bruising, which takes time to settle. You have to wear pressure garment for 3 to 4 weeks so that the skin retracts back and takes up a better contours. You should avoid raising your arms above the shoulder for 2 to 3 weeks. You should always avoid strenuous activities that would include rigorous movements of your arms, as it can lead to the stretching of the scar. So I would like to conclude by saying that the results of the arm lift procedures are long lasting if you are able to maintain a stable weight and a healthy lifestyle. Thank you.